and welcome to Book 101 Review. Book 101 is about the books that I read for the last 40 years. And today I have my special guest. He's a MD founder, Precision Identity, AI in Radiology, and Smart Investing for Clinicians. Other than Dr. Pouyan Golshani. Welcome, Dr. G on Book 101 Review. And can you please introduce more about yourself that I miss?
Of course. It's a pleasure to meet you. So, I'm, I guess we'll start at kind of at the beginning. I'm a first generation immigrant. I had to learn about finance myself throughout the years. And you realize in medical school, which is my dream when I was younger to go to, is that you don't really learn much about finance or money or anything outside of just the healthcare portion. So in doing so, I had to kind of learn to put myself in a position so that I can make decisions that were a little bit more intelligent than just look at this and maybe it's going to go up or maybe it's going to go down. That required me to learn a lot about data, learn a lot about AI and how it fits in, especially over the past several years. And in so doing, I've been lucky enough that I've been able to find niches for myself, and I found myself at an intersection where most people don't really, in medicine at least, seem to venture, which is AI and just kind of building different apps and also the finance side of it. So I tend to consult with medical technology companies on their medical devices, a lot of use cases, and then in so doing, I've also created my own applications. One of which is Rad Report AI, which helps radiologists with dictations and making sure that they're less likely to miss differential diagnoses, report things out quicker with billing, which is a big pain point for radiologists, and things of that nature.
Yes, and thank you so much for sharing your knowledge and wisdom to the world. Dr. G, thank you. And today let's talk about AI, medicine, and markets. What professionals must know for the next 5 years. What is the single most urgent thing that doctors, healthcare executives, and investors each fundamentally misunderstand about the convergence of AI and medicine that your book aims to correct?
So to be frank with you, I think a lot of people tend to think that AI is going to replace them. this
Yes.
is this is true outside of medicine, and it's definitely true inside medicine. I'm sure you hear it as well. There's a lot of fear, but there's a conversation I've had with people who ask me things like, "Hey, what should my children go into? Is this going to be a dying field, for example, radiology or various parts of medicine?" But what I do think is that just like any other technology, I think you were probably around the times when there was the computers came about and became really popular, and everybody was afraid they were going to take over all everyone's jobs, and people quickly realized that it was a tool. It helped people. It didn't take over their jobs. It didn't take over their lives. Maybe some of the guys who did lose their positions were the guys who would pull the levers on the elevators, 30, 40 years ago. That got replaced by a computer. The accountants doubled. Everybody thought the accountants were going to go away. So basically, all this to say that, it's not, AI is not here to replace you. AI is here to aid. And I think one of the misunderstandings in medicine, just like everywhere else, is that AI is coming and it's going to basically take over a lot of the jobs. And again, I think maybe the lower level portions of jobs, a lot of the portions that people don't want to do, will be taken over, and hopefully some of the more dangerous jobs will be taken over. But as far as taking over positions completely and entirely, I think that's a fallacy, and that needs to be corrected.
Dr. G, we've seen waves of tech promises or promise in the healthcare before. What makes this AI convergence different, and what are the next 5 years genuine point of no return?
So I think over the next 5 years, what we're going to see is, individuals coming up with methods to integrate AI into systems and create safety, especially in medicine. One of the problems is that obviously patients come in there and then sometimes they hear these horrible safety stories or issues, and AI is here and what it will help with, and this requires a lot of creating guardrails for AI, but what it is here to do is make things safer and quicker. um, in the next 5 years and beyond, I think what you're going to see is that safety improvements are going to exponentially increase. AI is going to be there to double check things. Even for example, for our Rad Report AI program, if someone dictates something that is not congruent with the indication for the study, for example, someone is looking for right lower quadrant pain, but the person dictating the report does not mention the right lower quadrant in the dictation, it'll flag that and it'll tell them, hey, listen, you missed this. Go back, take a look. Things like that are going to be very helpful. It's quite easy for AI to do, obviously, with the right guardrails. You know, there's a part of it that you have to be uh, I think, quite cognizant of when you're building these apps, which is AI does confabulate. It will come up with things that aren't very useful. And if you're not careful and you don't build those guardrails that I keep repeating and harping on, you will have issues. But if you do that, you're going to be quite successful. So in the next 5 years, I would expect this trend to just continue to grow. There's nothing that is going to overnight change the world in the way that I think some people think it is. But over the next 3 to 5 years, you're going to have amazing advancements. You see companies that are developing things like DeepMind. They're looking at protein folding. Those kinds of companies in healthcare are going to do amazing good and help millions, if not billions, of people out of diseases that they would have otherwise had to fight with. And you know, these pharmaceutical companies, they're honestly, they get a bad rap, but a lot of them are doing God's work. They're doing a lot of research that generates income for them, and they have to be good stewards of their investors. So they're looking at things that can make money, but in so doing, they're gonna skip out on a lot of diseases and issues that don't have a lot of financial backing and don't make them a lot of money. And I think that's where AI comes in. AI is going to come in and help with that and be able to make those things that maybe would not have been financially viable in the past to be financially viable now. So in the future, we're going to see a lot of good things, I think.
For practicing a physician or hospital administrator, Dr. G, what is the routine task or process that you predict will be obsolete within 5 years due to AI, and what will be replace it?
So it already is. I mean, there are things that AI is already replacing. I think reporting, you have to understand that in medicine, a lot of the issues are that patients come in and they can't stand the fact that they have to sit there for hours and wait for their physician, rightfully so. Sometimes they can't even get an appointment to see the physician, and these are all problems. A lot of that is due to the fact that there is a lot of charting that goes on. There is a lot of compute that goes on in the back end that is not directly related to patient care. It takes the clinicians away from uh, their actual direct patient care abilities, and it also takes them away from providing the kind of care that they want to provide. There's a lot of physician dissatisfaction, and there are reports and surveys of this that's directly correlated to the fact that people don't really have the ability to take care of patients like they used to 20, 30, 40 years ago. Now, that's not to say that this documentation is bad. It's great. We need the documentation. You don't want the physician not to be able to document what he does. But spending an inordinate amount of your practice typing away is not the way to deliver good patient care. So there's AI systems that have come in, where they'll actually have devices where we keep them in the clinic when we're seeing patients, and it'll dictate the conversation between the clinician and the provider. There are systems that help providers when they're, dictating various reports. They don't have to dictate in order of exactly how they saw the patient and the physical exam. They can disorderly dictate, but the AI will report it in an orderly fashion. Just that simple change is hugely helpful to them. So it's already in the clinics, it's already helping. It can be misused. I'm seeing that as well. There are situations where AI is being used to track and see how quickly, for example, a procedure is done, or how quickly something gets completed, and unfortunately, that can be great, but it can also lead you to the wrong conclusion with regards to the data that you have. So obviously, there's data analysis that has to go with all this new information we're getting, but if it's done correctly, it's hugely helpful, and it already is.
Dr. G, let's talk transforming medical practice and the human role. Will AI in 5 years will be a second opinion tool, the primary screening mechanism, or something else?
I think it's going to probably be in the primary role, primary screening role, and then it's going to be audited by the physician. In the end, there you have to have somebody on the other end of it to say, "Hey, this person is responsible for this report or this patient visit." And that's not going to be possible if all you have is agentic AI in the background looking at an image or hearing your clinical story. And quite frankly, when you run across physicians or you run across patients, you understand something, that patients want to have conversations. And you know replacing them with and I'm sure some companies are not only going to try to do this, they already are, replace that clinical visit with an AI. The problem where you have with something like that is that AI is not conscious. Despite all these conversations and TikToks, and people bring me all this stuff about, hey, AI, it's not self-referential. It does not know that it exists on its own, and as a result, it's not able to make decisions and connections with other people in the same way, and it becomes a screening tool, but not a replacement tool. And I think there's so much fear behind that, which is why I harp on that. We use AI not only for reporting in medicine. I have a repit.org where we use AI to go over vast data for every zip code, city, and county in the entire United States for real estate. And we have people who come to us looking for real estate investments. And this was born out of something I did for myself, where I was looking to invest in real estate. I live in California. It's quite difficult to do that here, and I was able to use AI and the data that I have to basically sift through, make investability ratings for each and every single city and zip code, and basically find myself properties that I could invest in that would cash flow and do well. So it's not just going to touch, healthcare. It's touching investments, real estate, due diligence, anything you can imagine. I think is going to be highly affected by it. But generally, as a screener, you have to have someone on the other end of it making sure that it's not confabulating and the stuff that it's doing is useful.
Useful indeed. And Dr. G, beyond data literacy, what would be the most valuable human skills a medical professional must cultivate to remain indispensable and effective in an AI augmented clinical environment?
So I think there's two things. Do what you love. If you love it, do it. Now, you can look at any industry. If someone loves what they're doing, they're successful. It does not matter if people are doing work with their hands, or if they're doing more academic type work. If they love what they're doing, they will be successful. And the second part of that is interpersonal skills. You will be successful beyond measure if you have interpersonal skills. You're able to convey ideas and thoughts and tell stories to people, and I think we all intrinsically understand that, but it's hard to clearly get that across sometimes, especially to younger kids we talk to. But if you're able to do those things, you will be successful.
Indeed, you will be successful, people, if you do your job properly and you love your job. Data ethics and the patient itself, Dr. G. You discuss markets is the most valuable asset in 5 years. Healthcare, not a direct patent, but a something else. So tell us, how does this shift investment?
Sorry, repeat your question. How does a data
How,
help with?
yes, how you discuss market is the most valuable asset in 5 years. Healthcare is not a drug patent, but how does AI training data set and how does this shift investment for us?
So it depends how you're looking at it, but if you're specifically talking about investments in equities, it's one thing. People are always looking for an edge. Something that hasn't been looked at, an angle that hasn't been considered yet. And I think, you can make just immense strides with AI, with back testing, with neural networks and programming various things to be able to test ideas. I think back in the day, it was very difficult for the average person to come up with an idea, an investment idea, a thesis. It doesn't matter if it's in equities, in commodities, in real estate, in anything. It was hard for them to bounce off ideas or to be able to actually test their ideas. And that is going by the wayside because you can use AI to help you do that. You can, uh, come up with an idea and basically be able to pass it by one of the most well-read people or things that you can imagine, and that would be an agentic AI in any iteration that it currently exists. And you'll get some feedback. The problem most people have, I feel like, using AI is not that, the AI is an issue, it's that they don't know the question to ask. You have to know the question that you're asking, and you have to frame that question correctly. And if you do, you're going to get much further than you were, and you will be able to get answers as to your investment thesis. And some people will go on there, unfortunately, and just pop in five or six different stocks and say, which one should I buy? I've seen that. That's dangerous. You don't want to do things like that because that's not a good question. The question has to be, hey, approach systematically, just like you would approach a patient or you would approach a mechanic would approach an engine, piece by piece, going through the question and saying, hey, listen, what's the price to earnings ratio? You have to break these problems down into simplistic terms and see if you can get from the beginning to the end. And then after you do, if your thesis works out and you see it's logical, you can systematize it. You can make it into a system where it's not just individually going and figuring out if this is going to work or not. For example, like when we're talking about real estate, going to AI systems and just asking where should I invest does not work. But if you start looking at price to rent ratios and trying to break it down and see which city has what, you can get an immense amount of information out of that. And that's kind of what we're doing at Repit and helping people find their niche and where to go and where to invest. So it's those kinds of things I think AI will help with as far as their investments and checking their investment thesis and seeing if it plays out in the real world.
In the real world, indeed. And how much the process of informed consent evolve when treatment plans are generated by inscrutable algorithms? Do patients have the right to explanation of the why behind an AI recommendation?
So I don't think AI should recommend blindly. If the question is, would and I don't think anyone, well, I do think there are some people proposing that, and there are companies that have drawn large, vast sums of money to do exactly that. I think you are correct in that, but this is not something that I think will pan out in the long term. uh, Patients should absolutely. And again, I'm not saying this as a physician myself. I'm not trying to protect my own position. Believe me, I'm okay. I think some of the stuff is that people think that when we criticize these kinds of systems of just AI being able to pop out a treatment plan, it's done because of self-interest. I myself would love the idea of having healthcare that requires less financial input by patients. I see it every day. It's costly, it's slow, it has problems. There's a lot of bureaucracy behind it. I wish this didn't exist. And if AI tomorrow were to come out and be conscious and be able to make these recommendations clearly and without issue, I would be all for it. But unfortunately, at the moment, and probably for the next 5 years, if you're familiar with how AI works, this is not going to happen. This is pattern recognition. These are very complex systems that are basically looking at pattern recognition to know what the next word that it should generate is. That's not going to be able to give you the results that you need, and definitely not in every situation. So of course, if patients are faced with and some patients do it themselves, they'll go and upload their own information on AI. And I see it myself because I have people who come to me and say, "Hey, AI told me this," and some of the stuff is wild, and some of the stuff is great. It'll some doctors don't sit down with you and give you a lot of information, especially about nutrition and health, and AI will do that. It'll sit there for 2 hours and talk to you, but you have to understand the reason it does that is because you're asking it the right questions. So does it have a use for that? 100%. For us, even with Rad Report AI, what we do is we'll include some patient, and the clinician can decide to include this or not. It includes a little paragraph at the end to the patient explaining, hey, this is what diverticulitis is. It happens because you have, for example, constipation. Avoid these types of food, but eat these types of food. The clinician, no matter what, should definitely review the content in there. They cannot accept that, but it is exceedingly correct generally. So for those kinds of things, wow, I think it's phenomenal because clinicians generally will not dictate in a report what a patient should do. When a patient follows up with their clinician, a lot of times they're not able to even get that information. It's a simple thing for us to educate the AI on the back end and create those guardrails to include for the patients. So I think for that kind of stuff, again, phenomenal. But as far as completely replacing or not having any kind of checking by the clinician of this information, that is not a great idea. I don't think it will be for many years to come, and it shouldn't be tried.
Dr. G, as a MD founder, physician identity, AI in radiology, what are your short term and long term goals?
I think short term is easy. I have a young family. I want to raise them. I want to be involved in kind of the medical, and I truly believe that. So short term, I want to continue doing this and expanding it and educating. I've always been interested in education and teaching. I have students, and I love teaching them. So that's something I'd like to continue. I love teaching my children. I love learning myself. I started off making WordPress websites. I had no idea what I was doing until I did it and got better at it. So I think I want to do that in the short term. In the long term, it's much broader. Um, you know, Obviously everybody has dreams, and I'm no different. Um, to have impact and to grow the things that I think are useful to society. But I also know that a big part of that is working on myself. So hopefully being able to do even better by myself and my children, my family. And I think in essence, if I can do that, I'll be able to do more to help others as well.
Good luck to your goals, Dr. G, and looking forward for more success. And what would be your piece of advice for those people out there who want to be like you?
I think there's several things. One is, like I said, figure out the things that you love and chase them. Don't give up. And sometimes you have to put aside your ego. You have to put aside that part of you that tells you you're either afraid, that you can or cannot do something. And if you love it and you want to, just do it. Go for it. If it works, great. If it doesn't, you'll learn from it, and you'll be better for it.
Yes, and thank you for that advice, Mr. or Dr. G. And can you please recommend a book or books to influence your journey?
Yes, I think one of the books that I enjoyed reading was *Sapiens* by Malcolm Gladwell. It helped me kind of frame things for my children and understand humanity a little bit better. So I would recommend that book.
Yes, thank you for that recommended book, Dr. G. So, for a healthcare professional feeling overwhelmed, what is the one concrete action you prescribe that should take this quarter to prepare for this future?
This is something we talk about significantly, very commonly in the hospital setting, especially during COVID. There was a lot of burnout. I think the best thing someone can do for themselves is to be frank with you, to take time for themselves and do things such as meditation. Just that time alone that you get to spend quiet. We're so involved in looking at our phones, so involved in consuming media, social media, and otherwise, that people, I think, forget that other people exist around them. They spend less and less time with other people, and sitting down quietly and meditating, bringing your, whichever way you do it, there's many ways to do it, is extremely helpful for people to. And I've seen it myself, for myself, and in friends, that it helps people with their calmness and just, you know lessen burnout, for sure.
Definitely. And Dr. G, will AI in medicine widen or narrow the health equity gap between wealthy and developing nations in the next 5 years?
I hope it narrows. I really do hope it narrows. You know, there is unfortunately lack of access to a lot of things that would otherwise be very helpful to, a lot of the countries that unfortunately don't have the finances to be able to achieve the same healthcare as we do. Now, obviously, outcomes are not phenomenal in America, and that's due to a multitude of reasons that we can discuss as well. A little bit more touchy, but quite frankly, I think AI will help narrow that. It is one of those things that, oddly enough, economically, even in America, will lessen inflation, I believe, just like Amazon did. It's an odd thing, but it does do that. So it'll make things overall cheaper, which is great. And I think that it's hard to stop that from overflowing outside of the country as well. So a lot of these apps, like for example, the alternatives. I'm not bringing this up for any reason except just as an example, but for people to use dictation systems outside of the country, in Mexico and other countries, these dictation systems for reports are thousands of dollars. They're several $1,000s, and a lot of these countries don't have access to things like that. When you have web-based apps like Rad Report AI, you can use that, and it's going to have pricing for different countries. You can use things like that in other countries for very reasonable prices that will go nowhere near the prices of these enterprise systems that exist. So I think it's definitely going to narrow. I have no doubt about that. How quickly it does that really depends on, how many people are interested in delving into that. But slowly, I think they will.
Yes, definitely they will. And before we wrap up our discussion today, Mr. G, I'm inviting you to please do listen to my other podcast, people. My other podcast, because my abstract essay is already in fifth season. Abstract poetry in second season. I'm on book 101 review in fifth season too. Comedy 101 in third season. And my food 101 in fifth season as well. Geography 101. Love Letters, Movie 101, Music 101, our fourth season, Science 101, Sex 101, second season of my baby podcast, Law 101, Mental Health 101, Bible Verses 101, and coming this December, Entrepreneur 101. Please listen to them wherever you listen your podcast. So, Dr.
Beautiful.
G, if we were to sit here 5 years from now and you had been right about the key transformation, what would we point to us as the most significant tangible change in how healthcare is delivered and paid for?
I think you're going to have a lot more satisfaction on both ends, both clinicians and the patients. And I think the way that it's going to be delivered is going to integrate a lot of these AI systems to be able to communicate to patients. You know, we'll see things like patients having emergent or urgent findings, and unfortunately not being reported to the patient, or not being able to reach the patient because the clinician will call 3 times and not be able to reach the patient, and they'll have to pass that on. That's going to go by the wayside. You'll have a system, as they already do now, not implemented exactly the way that I'm describing, but you have a system where you basically tell the AI to constantly call the patient, email, or figure out a way to reach them. And the AI can easily do that. So I think things of that nature are going to make it communication much simpler between clinicians and patients. It's going to help with burnout, and it's going to help patients understand their diseases. You know, it's funny. Uh, for several years, I think physicians and clinicians were afraid to talk to patients about a lot of things that they should talk to them about. And now in my own practice, what I notice is patients are hungry for that information. You know, sometimes I do a lot of procedures while patients are awake. That's just how my procedures are done, because patients have to take respiratory instructions while I'm doing the procedure. And because of that, I talk to them constantly, and honestly, I see how interested they are to, and how hungry they are for medical knowledge and information about their own health. And I think this is where AI is going to, 5 years from now, going to change things. It's going to level the playing field. So you're not in front of a doctor who knows everything, doesn't have time to talk to you. You're going to be able to understand these things yourself. You have a question about something in an imaging report, or you have a question about a finding, or cholesterol, or a diabetes patient. It's going to be much simpler for you to be able to figure out exactly what the options are, and how to get it delivered in the best way.
Yes, Dr. G, thank you so much for sharing your knowledge and wisdom to the world. And so, can you please invite our listeners to support your advocacy or any projects that you're doing right now?
Of course, if anyone's interested in any of these projects that we're in Rep It for the Data, Rad Report, or Guide MD, which is a social search engine for physicians, check us out on gighz.com, and you can message me directly and our team, and we'll get back to you.
Yes, people support Dr. G because if you support him for sure, more and more empowering advocacy like this to come. So, Dr. G, thank you so much for your time.
It was a pleasure.
Modicam people, see you soon.